Next, we're going to go over what is going to be commonly referred to as a walking boot. Now, the specific model of this is going to be the Air Select Standard, and it's different size. Before going into the DME closet, make sure you ask the patient what size shoe they wear, because you will find literature in there that will determine what size boot you need given the size of their shoe. So, starting to unpack it, I'll remove my packaging. Inside the boot, again, we're going to find our product order form. Again, please fill that out. Further down in the boot, we'll actually find an instruction manual there. Now, there are several parts to the walking boot that we're going to go over. First, we're going to have our straps that we'll use to tighten down, and I'm actually going to remove these straps so I can remove the front plate. Straps are going to be removed so that I can remove my front plate for fitting. On the side here, we can actually see that we have a pump for the air cells. This would be the deflating valve for said air cells. And then you will find a selector for the air cells down here. You'll begin to open this up to start to fit your patient for the process of getting them into the boot. Heel is going to come in here. Going to place these down. You'll fit it snugly on the patient. Then you'll put the front plate back on. And then you'll go to actually tighten the straps next. You will start from the bottom up, tightening the straps to the patient. Once you have this snugly on, you can then go to your air selector to pump up the air cells. Again, selector, you'll see a number 1 here, a number 1 here on the side. I can turn it to number 2. We'll have number 2 here on this side. Once you pump up enough, you can turn to the different zones to get the appropriate tightness and then lock it in. It is very important that these are not over tightened to not cause any skin breakdown with the patient, as it may be too tight. We also don't want to cause any neurological symptoms. Now we're just going to show a close-up of the pumping system for the Aircast. Again, you're going to have your selector down here where we can see number 1, which will correlate to the right side of the boot. Once I'm ready, I can give this a few pumps to make sure it's snug. And if I have to relieve any pressure, I will depress this button. Now if I need to go over number 2, I turn the dial so that it's 2, and that'll be for the left side of the boot. Again, I can pump till it's snug to my patient, and if it's too much, I can always release. Once I have my desired air pressure, I can turn it into the lock position, and then I'll stay in place. Once we've disassembled the boot, we're ready to fit it to our patient. We have to remember that this is a universal boot, so it will fit either leg. The patient must be seated. I'm going to bring the foot all the way in, fitting it all the way to the back. I'm going to tighten down, and then I'm going to bring my front plate in. Now again, I'm going to start by tightening my straps from the bottom up, making sure they're snug, they're not causing any issues. Feel all right?
It does.
Okay. This point is when you would come over to adjust your air cells, pumping up till it's snug.
It's starting to get snug.
I go to the second chamber to do the other side and tell them to let you know when it's snug.
Okay.
I will turn it to locking, and now the patient should be ready to be checked out. At this point, a nurse should make sure that the boot is fitted properly, is not causing any pain or discomfort, and should also check for circulation, sensation, and movement distally.